Hello, I'm Andrew Harvey. I'm a psychotherapeutic counsellor based here in Nottingham, and I also see clients online if they're further afield. One of the areas I work with is addiction to substances. This can be drugs or alcohol, and I also work with people who are struggling with compulsive behaviours. In this short video, we're going to look at alcoholism, some signs to look out for that might indicate a drinking problem, and most importantly, how counselling or psychotherapy can help you address that issue. Alcohol addiction, also known as alcohol use disorder, is often referred to as alcoholism. Alcoholism can affect people's physical health, mental health, their lives generally, and the lives of those around them. In my experience, the sooner someone addresses a drink problem, the better. It tends to get worse over time. If it is thought that someone has a physical dependency upon alcohol, it's extremely important that medical assistance is sought before they change their drinking pattern. It can be extremely dangerous to cut down or stop if there is a physical dependency. People's relationship and problematic relationship with alcohol can look different, but there are some common signs that might suggest someone is either becoming alcoholic or already is in the throes of alcoholism. These might include secret drinking and being dishonest around drink. Drinking past what they intended, that is setting a limit and then regularly going beyond that. Increased tolerance, in other words, needing more drink to do the same thing. Drinking alone, feeling that you should cut down and then failing to do so. Sometimes people might become annoyed if their drinking is pointed out by others or they feel criticised. Others expressing concern. Now this might be a medical professional, family friend, member of the family or a colleague. Drinking increasingly earlier in the day can be an indication that there is a dependence forming on alcohol. Drinking to try and cope with difficult feelings or experiences. Urges or cravings, these can be in the form of obsessive, compulsive thinking around drink, or they can be a feeling. Becoming irritable if you want a drink and then can't get a drink. Drinking despite negative consequences to self or others. A clear indicator for me that someone might be experiencing an issue with drink is that they've made repeated attempts to either cut down, slow down or stop and been unable to maintain that change. This is something that requires investigation. Counselling can offer someone the space to honestly and openly, without judgment, experience their relationship with alcohol and decide if they need to make changes and then how they might make those changes and maintain them. Now, for someone with alcoholism, the only way forward is abstinence. It's important that they stop drinking and stay stopped. With somebody who has a drink problem that's not alcoholism, it may be possible for them to do controlled drinking in the future. This is something that can be explored in counselling. Once the new way forward has been decided, you can, with your counsellor, go about achieving this. This might include ways to cut down, relapse prevention and relapse management tools. This is a great way to move forward with some tools in your armoury and increase your chances of making the change and maintaining it. Following this, it's important to work out what might be behind the alcoholism or the drink problem. What pain might have you been medicating away? Is it loss, grief, stress, anxiety, depression, past traumas? Quite often, when we're seeing alcoholism, we're seeing someone who's trying to medicate away some difficulty unsuccessfully. I often say the medicine of alcohol eventually becomes the poison. It's really important we address any pains or hurts that are causing the alcoholism and the drinking. If you or someone you know is struggling with an alcohol problem, counselling can help. On the counselling directory, you'll find a number of therapists that work with people who are struggling with these issues. Some are working online and some are working in person. I would encourage you to move forward. Recovery is absolutely possible.